Hi, today we're going to be doing a physical assessment. We're going to be focusing on the head and the neck. So the equipment that I'm going to need is an otoscope and just the basic physical assessment. So I'm going to provide privacy. I'm going to wash my hands and then I'm going to go in and start. So the first thing, you're going to observe the general appearance. You're going to look at the clothing, you're going to look at the hair, the general hygiene, notice any smells, notice how they're reacting to you. That tells a lot. So make sure they're clean and not disheveled. Look at the skin color, make sure it's warm and pink. You can do this just by greeting them and making sure they're alive. You're going to notice their mood, how they are speaking, their mannerisms, and as they interact with you, you're going to be noticing whether they can hear you, whether they can verbalize things, and just the general understanding. You're also going to delve into a nutritional status, making sure they can eat, making sure they can swallow, making sure they can smell their food. That tells a lot as well. So we're going to start with the head. So the first thing I'm going to do, I'm going to grade the person. I'm going to make sure they're having eye contact with me. I'm going to look for the level of consciousness, which she is alert, she knows where she is, she knows who she is, she knows what time it is, and she knows why she's here. So that's, oriented times 4. So the first thing I'm going to do is I'm going to touch your head, and I'm going to take your headband off just a little bit. And then I'm going to feel the scalp, feel underneath the hair, feel the bones, make sure you're feeling for any lesions or bumps or any dents in the head, anything that would be abnormal. Feel the back of the head as well. And then you're also, while you're doing this, you're going to look at the hair, make sure it's clean, make sure you don't see anything that's not supposed to be there, any lice, or any dandruff. Okay, looking at the cranium. Okay, thank you. The next, you're going to look at the face. You're just going to look at the symmetry of the face, make sure nothing's out of place or drooped to one side, making sure the nose is straight and not deviated, looking at the ears, making sure they're formed in completeness. And then you're also going to look at the temporal artery, which is right here on the temporal. Okay. And then you're also going to look at the maxillary bone and where it meets the temporal, pretty much just the jawbone. Okay. Okay. Now we're going to move on to the eyes now that we've looked at the general structures of the face. So first we're going to do a peripheral vision test, which I'm going to place my hands behind your head on both sides, and I'm going to bring them forward slowly. And when you see them, just say yes. And it's just going to test where you can see, okay? So I'm going to go behind you. Yes. Okay. Yes. Okay. Yes. Okay, I'm going to go overhead. Yes. Okay. So you're going to go side to side, up and down, diagonal, make sure they can see all different areas. Then we're going to go ahead and get our light and turn this on, and we're going to check the reflexes. So look straight ahead. I'm going to shine a light in your eye, and you're going to see if that pupil constricts, which it does, and then you're going to look at the other eye, and you should have consensual constriction. Go to the next one, and it constricts. And then look at this other one and shine it again, and it constricts as well. Alright, then you're going to look at the red reflex, which you're going to look through, and you're going to shine it on the eye, and you should see the pupil turn red. And then if you get close enough, you can look at the back of the eye and look at the structures, look at the veins and the arteries, and just to check for the health of the eye. So go ahead and look straight ahead at me. And you're going to go left to left, make sure it's not awkward for the patient. So look straight ahead. Okay, I'm going to touch your face right here, honey. And you're going to go up. I'm going to look into the eye, which looks healthy. And you're going to do the same for the other side. Okay. Turn this off. And then after that, you're going to test the cranial nerves and how they can move their eyes. So I want you to follow my finger. I'm going to go up, down, side to side, diagonal, diagonal again. Great. All right, now follow my finger all the way to your nose. Okay, very, very good. Alright, I'm going to do the cover test as well. I'm going to have you cover one of your eyes. You can still see. Okay, the next one. Okay, great. Alright, so now that I've done that, you're also going to look at the structure of the eye. You're going to make sure the eyelashes are intact. You're going to look at the sclera. You're going to look at the conjunctiva, which is the corner of the eye. The sclera is the white part of the eye. The iris is the colored part, and the pupil is the black. You're going to check for perla, which is also the constriction of the eye with the light, which is great, and the pupil size as well, if it's really, really dilated versus really, really constrict. Okay, and then also, you can also do the Snellen vision chart, which is when you stand about 20 feet away, you cover one of your eyes, and you read the chart, and then you switch and do that, and then you can have a number of whether you are nearsighted or farsighted. Okay, now we're going to move on to the ears. So first you're going to start, if you turn your head this way, you're going to look at the structure of the ear. Make sure again that everything is where it needs to be. Okay, and then also with the otoscope, I'm going to disconnect this. Turn my light on, make sure it works. You're going to go ahead and look inside. Just going to play this in the ear canal very carefully. And with adults, you're going to take the top of the ear and pull up. With children, you take the bottom and pull down. So you go ahead and look through. Visualize the color, visualize if there's any wax, and go ahead and find the tympanic membrane. And you're going to do the same thing on the other side. Okay. Now you're also going to do a whisper test. So I'm going to have you occlude one of your ears, not yet, and I'm going to say either a 1 or 2 syllable word. I'm going to whisper it, and you're going to tell me and say it back what I say, okay? Go ahead and do it. Apple.
Apple.
Okay, I'm going to do the other side too. Pizza.
Pizza.
Perfect. Okay. Now, I'm going to go ahead and look at the nose. So again, you're going to look at the structure, make sure the septum is not deviated, make sure they have both nostrils intact. I'm going ahead and going to occlude this one. I want you to breathe through the other side, okay? Okay. And you can breathe through both sides. Okay. I'm also going to get the light. I'm going to have you tilt your chin up, and I'm going to look inside your nose, okay? And you're just going to look at the tissue and the mucosa inside. Make sure it's not occluded, and make sure that mucosa is nice and pink and it looks healthy. Okay. Now we're going to move on to the mouth. And again, you're going to look at the lips. You're going to go ahead and open your mouth and stick your tongue out and say ah for me. Okay, and this tests cranial nerve 7, which is the facial nerve. Go ahead and open up. I'm going to shine this light in your mouth. Okay, stick your tongue out for me again. Good. You're going to look at the tongue. Tilt your head up, honey. I'm going to look at the palate. Make sure it's not deviated as well and you have no structural abnormalities. I'm going to look at the teeth. Make sure there's no holes or missing teeth or cavities. Looks great. You're going to look at the mucosa, make sure it's nice and pink and moist. Go ahead and lift your tongue up and look underneath. Okay, very good. Alright. And then you're also going to look back at the uvula. Stick your tongue straight down like you have a candy in your mouth. Okay, yep. And it's there. Alright. Now we're going to go on, and we're done with the head. We're going to go on to the neck. We're going to palpate for the lymph nodes. We'll also palpate them in the head a little bit as well. And what you're feeling for is anything that's enlarged or hardened or swollen. So we're going to start here. And just gently palpate with 2 or 3 fingers in a circular motion. And you're just going to feel for anything swollen or enlarged. Get down the neck. Okay. The back of the head. Okay, while you're here, you're going to check the carotid pulse. Good. And then gently palpate the trachea. Make sure this is also not deviated. Okay, go ahead and swallow for me. It's okay. Okay, very good. Alright, now I'm going to have you push against my hand gently and tilt your head that way. Just your head. Okay, I'm just checking your muscles. And okay, now back. And then forward. Very good. Alright, and that is how we do a head and neck assessment. Thank you.